Your child or baby was just diagnosed with RSV. What should you do about it? I'm going to tell you some of the things you can do to help relieve their symptoms, and then I'm going to tell you some of the red flags that you should be looking out for that would mean maybe a trip to the ED. First and foremost, RSV is a respiratory virus. And yes, I said virus, meaning that there is no quick fix medication that's going to get rid of it. It just has to run its course. So here are some of the things that you can do to help keep your child comfortable if they have RSV. Number one is sucking out all that nasty snot and mucus that is just piled in those airways. The more you can suck out, the better it's going to help them breathe. Number two, you are going to control their pain and or fever, and you can do this with Tylenol and or ibuprofen. You can give Tylenol or Motrin if they are having fevers, but you can also just give it for general discomfort. Number three, you can use saline spray to actually loosen the secretions and make it easier to suck out. Number four, you could run a cool mist humidifier in the room to also help loosen up the secretions. What are the red flags you're going to look out for with RSV? And number one is any difficulty breathing. This is particularly important for the babies. If your child is having any signs of difficulty breathing, including rapid breathing, hard and deep breathing, retractions in the chest, which is where you can see the muscles sinking in between the rib cages while they're breathing, nasal flaring, which is where the nose is flaring in and out when they're breathing, any kind of rhythmic grunting that you can hear when they're breathing, or obviously very late signs being any changes in color in the mucous membranes or in the body in general. Any of these signs when your kid has RSV, but particularly the babies, is a trip to the emergency department. Number two, red flags to look out for. A lot of babies with all that inflammation everywhere and just general discomfort are not eating like they should. You have to remain hydrated. And the number one sign of them being dehydrated, a decrease in urine output or no urine output, this could be a trip to the ED. So do your best at the beginning of the illness to push as much fluids as possible. Obviously, water is best for infants, babies, their formula, their breast milk. Also use some electrolyte solutions such as Pedialyte to help rehydrate these patients. Your provider should always be talking to you about your diagnosis and what to do from there, but these are just some of the things to look out for and be ready for if your child was diagnosed with RSV.